Well, hello and welcome. We are thrilled that you have joined us for today's forum. It's entitled The Road to Allyship, Playing Your Part in Racial Equity. I'm Rachel McCrickard. I am the CEO and founder of Motivo, and I'm also a licensed marriage and family therapist. And for those of you who are unfamiliar with Motivo, let me quickly say that Motivo is an online clinical supervision platform. We have a robust network of about 1,000 clinical supervisors licensed in all 50 states, and we partner with behavioral health organizations to provide quality, accessible online supervision. And for today's event, we have 4 amazing panelists to lead us in this discussion. But before we dive in, I just want to say a very quick thank you to Anthem. They're sponsoring today's event. And Anthem has shown such dedication to speaking up about this important issue of racial justice and racial equity. We are so proud to partner with Anthem for today's forum. And I'm just going to pass it over to my friend, Meryl Friedman, to say a few words about Anthem.
Thank you, Rachel, and good afternoon and welcome, everyone. As Rachel said, my name is Meryl Friedman. I lead the advocacy as well as the disability policy engagement team here at Anthem. We're thrilled that everybody has signed up to join us today for the discussion. We every time get just really overwhelmed in the best of ways with the incredible interest in these conversations. And again, today we had about 1,200 people register. So it just really reinforces that there's no greater discussion for us to be having together to facilitate a deeper and richer movement towards allyship. And that's what we're going to do here. So I also want to cover a couple of things and just thank everyone who included a question in your registration. We do use those questions to shape the content of the conversation. So you'll notice that as the panelists start talking. I'd also be remiss if I didn't remember to ask you to please stay on at the end of the panel to fill out a quick online survey about the forum, because we also use your feedback. It's really important to us, and we use that to inform the upcoming topics and content. So please feel free to jump in with some suggestions. Some of you might have received notice that we would be offering CEs for today's session, but unfortunately, there wasn't enough lead time to pull that off. So we're lining it up for the next forum. That being said, you'll get an email with some follow-up on a possible certificate option or CE reciprocity. That will all come by email format. So thank you for joining us. Thank you for valuing allies and being an ally. And I'm going to turn it over to, well, actually, before I turn it over to the fabulous Dr. Malloy for facilitating, I am going to stop for a second and introduce you to my colleague, Dr. LeBird, who's going to share a few opening comments as well.
Thank you, Meryl. Good afternoon. I'm the Chief Medical Officer for the Medicare business at Anthem. And I just wanted to welcome you all and thank you so much for taking the time to engage and learn to help our members, to help you in terms of your interactions during these challenging times. One of the things that I wanted to share, and I think it's important as you embark on this webinar today, and it's from Dave Hollis. In the rush to return to normal, use this time to consider which parts of normal are worth rushing back to. And I think that's so telling because we've learned so much, and there's so much that we still have to learn in terms of dealing with a changing environment, with racial inequity. There's just a lot we have to unpack. And so I think today it'll help you, as well as dealing with your patients, to figure out the best path forward. So with that, thank you again. Enjoy the webinar. Dr. Malloy.
Thank you guys so much. Thank you for introducing everything, and welcome everyone to our Racial Equity Forum. We're so glad that you decided to take time and invest in this important activity, and we're really excited about all of the questions that you submitted beforehand. It's very clear that you're committed to this area and want to learn, and we have great people to help you with that today. I'll introduce myself quickly and then our fabulous panelists. I'm Dr. Demetria Malloy. I'm a Plan Performance Medical Director for Anthem's California Medicaid team. We serve 1.2 million patients over 29 counties in a very diverse area in California. And I'm happy to have been doing that work, and I've been with Anthem about 5 years. I'm an internal medicine physician and often work with our contracted medical groups and hospitals and all of these great external providers to make sure we collaborate and work on performance and share best practices and all of that. So in that vein, we're going to talk about some kind of different topics today and share those practices as well. We got a lot of great questions from you, so we're going to try and hit a lot of the different topics that were brought up. And we realized that sort of learning to be an ally and a partner, and we'll talk about some of those terms, in anything can lead to better results. But we totally acknowledge that this topic of allyship and of racial equity can be especially challenging, and that there needs to be some tools given, greater depth of discussions and a number of perspectives represented. So today we're going to do that, and I will start with introducing our fantastic panelists today. I see on my screen Jill Friedman, so I'm gonna go across the screen this way. I don't know how you guys are viewing it, but I will start with Jill Friedman. She's a licensed social worker and licensed family therapist, and is a co-director of Evanston Family Therapy Center. And I'm just gonna run through them and then give them each a chance to say a little bit more about themselves. Next is Dr. Carla Smith, who's also a licensed social worker and family therapist. She's a diversity inclusion consultant and owner of Roundstone Consulting. Glad to have her with us today. And then last but of course not least, we have Dr. Jean Combs, who's a psychiatrist and is also co-director of the Evanston Family Therapy Center as well. I'll circle back to you, Jill, and please let us know a little bit more about yourself and what brought you here today.
The main thing that I do is teach narrative therapy, and also I have a practice and consult with people. And I think one of the things that narrative therapy has brought to me, even more than my social work education, is thinking about the larger societal context in which problems are formed. So I think I'm really heartbroken about what we've learned about inequities, racial inequities, particularly in recent days, but I'm also really heartened by the amount of interest in people doing something different. So I think that's something that has me finding out more about this and wanting to talk with people. I also want to say that the Evanston Family Therapy is on Anishinaabe unceded territory. And I want to just acknowledge that the financial situation that I find myself in, I recognize has a lot to do with the oppression of people who had been enslaved and other oppressed people. And I feel like I really want to acknowledge that and be doing something in regards to that. So that has something to do with it too. And so thank you for the opportunity.
Thank you. Thank you for sharing that and being with us today. Dr. Carla Smith.
Hi, everybody. I am, as Dr. Malloy said, I'm a diversity and inclusion consultant. I work really at the intersection of social work and marriage and family therapy. I work specifically with mental and behavioral health care agencies to look at their policies, their procedures, their work in the community, and also to create safe spaces, safer spaces for their staff, their employees, the leaders of the company to learn how to provide inclusive and safe spaces. I'm here as a part of this conversation. I was thankfully invited by Motivo and Anthem, and allyship is something that I'm invested in, both personally and professionally. I myself am often working very hard to figure out how to disrupt oppression, not just the oppressions that I experience, but those of other marginalized populations. And I also am invested because, I'm raising children in a world that I would really love to be better than the one that I am living in and those of my ancestors. So I'm really invested in having these conversations today and moving forward. Thanks so much.
Great, thank you. Dr. Combs?
You're mute, Jean.
You're still on mute, yeah.
Yeah, I'm a psychiatrist by training. And I think I'm also a white male with a lot of privileges. I kind of sit at the top of the hierarchy. We're trying to do something about undermining and getting some equity in today. And I've for a variety of reasons spent a lot of my life trying to learn more about how to do good from the position I occupy in society. I think I was early on interested in community aspects of mental health, and that got me thinking about context. I've worked in community health centers where I was about the only white person there. And I think my experiences there made me want to pursue a path that's got me on this panel today. I want to join Jill in saying that I think one of the things we'll come back to over the course of today is how do we live our lives in such a way that we are conscious of the inequities that because they're so much a part of our culture, we just don't really notice them, or people that benefit from them, like me, don't notice them. So it's important to say things like our little center here in Evanston, Illinois, is located on land that was settled by Europeans and claimed by Europeans when and on the basis of genocide and tricking people out of what they did, out of their ownership of that land, and that much of the wealth that I have was the stolen labor of enslaved people. And you can say that in a performative kind of way that says, oh, look at me, I can say this and I'm all enlightened, but I think saying it in front of witnesses puts me in a position where I have to feel good with myself, live that out day by day in my life. So that's enough for a starter.
That's a great starter. As you guys can see, we have a range of really great perspectives here, and we're gonna dovetail that with some of the questions that you asked. And we'll start at first with, I think, what's a good framing question. Some of the terms that are thrown around, equity, equality, people are wondering what those mean and how they actually play out in some of the work. And allyship even, and what does that mean, and what are other terms, and et cetera. And from this range of perspectives, we really wanted to take a step back and speak to some of that language and say, what does those terms mean to our panelists? So equality, equity, allyship, those concepts tied together. Please, for each of you guys to speak to what those mean to you and how you translated some of that into your work. So Jill, we'll start with you.
Okay. I think equity has more to do with justice. And that equality, if we do things equally for people who have been unjustly treated and offered less possibilities through the years, then if we do something equal now, it just keeps the status quo. It doesn't respond to justice. So I think it's really, really important in thinking about these issues, to think more about equity and less about equality, because we're not starting in the same place through no fault of the people who are starting in a lesser place and through no merits of the people who are in a more privileged place. So I think that that's a real important thing. I think allyship has to do with standing with people. For me, it has to do with solidarity, standing with people rather than for people, recognizing the knowledge and goals and special and ways that people want things to be, and being with them and in trying to enforce those things. I've read a lot about, like, do you want to be, there's also, we could become accomplices where we're helping dismantle systems. So I think allyship is sort of a starting ground if we're interested in equity.
Great. Dr. Smith?
Yeah, what I would add to what Jill has already let us know is that, in addition, we using the term inequity or equity is about acknowledging that the playing field is not level. So this notion of, pull yourself up by your bootstraps, there are some people that don't have boots or straps. So, really being able to highlight the inequity of experience is important. And also to use our roles and our positions to say we're going to lead the charge, and the privileges that we have, that we will stand with, sometimes do our own work to do the work that's necessary to fight and disrupt. So yes, allyship is a word that I use. I really love accomplice. And here recently I've been using disruptor, just because I think that's more, that says more about my personality, that, I'm going to disrupt what might be status quo. Just because it's status quo does not make it equitable or good or right for everyone who is involved. And so moving people from the margins and their voices from the margins to the center takes people who are willing to challenge what is.
Great. Dr. Combs, what are your thoughts on this?
My other two panelists have covered that pretty well by this point, I think. I think a thing that helped me was there was a meme, a cartoon going around 4 or 5 years back that was just of 3 kids trying to look over a fence to see a baseball game, and there was a short kid and a middle-sized kid and a tall kid, and equality puts them all standing on the same size boxes. So the tall kid can still see over the fence and the short kid still can't see over the fence. But equity would give the shortest kid the tallest box to stand on. So that, and the middle-sized kid, a middle-sized box, and the tall kid, maybe not a box at all, so that they can all still see over the fence. So, but their heads are level. It's not that what they're standing on is level. Now, that was always a useful picture to me. And I think when we're trying to deal with something as huge and with as deep a roots as, as white supremacy, as institutional racism, it helps to think of yourself as it's always helped me to think of myself as a subversive agent, in any big system I've worked in. So that I'm always looking for the little cracks I can find to do something to further the causes of racial equity, and to undermine just that taken for granted supremacy that people at the top run around with all the time. So I would join you, Dr. Smith, in wanting to be an accomplice or an instigator, or not just an ally, but ally is pretty good too sometimes.
That's great. Thank you guys for offering all those. I sometimes get teased because I often use the term teammate with this as well. I'm a sports person, so that's also why sometimes my mind goes to that. I think sports teaches you a lot about life, but I think, you have a lot of different roles on a team, right? But everyone's is equally important, and you don't win without everyone playing theirs out, right? And I think sometimes, like, say for example, a football team, everybody over importance is already assigned to the quarterback and overvalue, which, even Tom Brady's position, you understand. But I think, but everybody on that team has to play their part or it falls apart, and they have a common goal, right? And it's all agreed upon and they're fighting towards it, right, together. So just another way to think about it. But I love accomplice, ally. And I think for the audience, it's where you find yourself sort of vibing with what term and the concepts and where you are in this process. For you to say where you can do your work and how you can understand other ways and other perspectives to think about it. So now that we sort of talked about that, I think.
I just wanted to add something. Motivo creates these groups, and a group that we're facilitating for Motivo has to do with exploring white privilege. And there's somebody in that group who's always saying that whiteness and individualism go together. And one of the things that we're thinking about is unpacking the idea of individualism. So I just was really hearing your team metaphor as really, if a white person wants to be an ally, instead of thinking individualistically, I'm thinking team is going to be so much more helpful. So that was what caught my attention. I just wanted to underline.
Great, thank you. So I will follow up with you on this next question and say, now that we sort of looked at your approach, some of the language you use and concepts, how have you used your approach to serve you and how you approach your work, delivering services to others, working with your clients, working with peers, et cetera? How have you brought that to your work?
As a narrative therapist, one thing that I'm thinking about is when I'm hearing something that's racist, or where I'm hearing somebody feel like a failure, I want to think about the larger context. I want to think about where they learned ideas about racism that I might be able to help unpack, or I want to be able to help them look at the larger context. So instead of thinking there's something about them as a person, looking at how much is in the way of their being able to achieve what they'd like to achieve, or comparing themselves to other people who've been in a more privileged position. So part of it is a vision, I think, from this that helps think about problems as located in ways that white superiority and the hierarchy established in this country takes over things, and being able to look at how that makes a difference. But I also think it's really, really important how we have conversations with people to open up ideas that might help both people who are caught up in racism and people who are seeing their problems as their own fault or their own deficiency, rather than looking at the larger context. I think it's really important how we talk to people. And I found that I don't consider that I'm an expert at this in any way, but I've had a lot of thinking about it and practice with it. And one thing that I think about is taking time to help people unpack things slowly. And another thing I think about is my own experiences getting things wrong. I think as a white person, there are things that I don't notice, that I assume that wouldn't fit for when I'm working with people of color or people from other cultures. And I have had the experience of getting things wrong and then feeling a lot of shame about it, or realizing later that nobody said anything. And I think that having had that experience has really helped me thinking about saying things, being able to stand beside someone and help unpack things and look at things from some different points of view, rather than attacking someone or saying something that could be shaming. So I guess, those are a couple of things. One of the things that helps me in that is partnerships with people of color, but in two different ways. One is to be able to call on somebody to supervise when I do get something wrong, or to talk about with me when I do get something wrong, when I'm working with a person of color and I get something wrong, to be able to consult with someone who could help, who's also a person of color. I was going to say something else and I don't remember what I was going to say.
If you do, we can always circle back to you.
Okay.
You said you were listing two things that it helped you with, but all right, you covered one there.
Oh, I
We
know
can
what
always
the
circle
other
back.
one is. I remembered.
Okay.
The other one is like having partnerships with people and imagining them there with me. So if I imagining a client, a colleague, somebody who's supervised me, who's in that same position, who's a person of color, imagining them with me in the room when there's a difficult situation makes it much more likely that I'm going to do something that we could call disrupting or being an ally, instead of sort of fear and wanting to keep things friendly, getting in the way. So that I find that really, really helpful.
Great. Thank you for those tools.
Thank you.
Dr. Smith?
Sure. So I would add that there's a lot of self-work that goes into being therapist and working in mental and behavioral health, period. But especially when you are working with, systemic oppression, there is a lot of time that we have to spend with ourselves. Because, one of the things that is important, two of the things that are important to own as therapists is your authenticity and your vulnerability. And both of those things are integral to work with our clients, but most specifically clients whose experiences are so considerably different than ours. Their social experiences, when they walk out of our office or when they walk out of their homes, their experiences are so different than ours that it takes, authenticity and vulnerability to say, I need to learn how to show up for this particular client. So that also leads to, cultural humility and really just being able to take the one down and say, I don't know everything about everyone. And in fact, I might know nothing about this person. So especially when we get caught up in there's this client who looks different than I, or who has identities different than I do, there's a lot of anxiety that comes up, because where are the gaps in our knowledge that will help them in reaching their goals? But what I have acknowledged is that our clients know everything that there is to know about themselves. We show up with the information, about how to help them, how to facilitate change. But being able to be with them, therapy, in my opinion, is what happens between people. And so if I'm learning from them and able to stay in this authentic and vulnerable space, therapy is still occurring, because my curiosity, my questions, my body language, the way in which I communicate, is one of humility that allows people to feel safe, and it allows people to share with us the places where we might need to know more about their experience. And more specifically, I think that it's absolutely important for us to do our own work as therapists. Our clients can help us learn about them, but it is not their job to help us learn or fill in the gaps about culture, or about oppression, or about their social experiences. That is on us to know. And so that takes conversations. It takes, going out and getting the information that is now so readily available. Watching videos and engaging in difficult conversations. And when we engage in difficult conversations, whether it be with our loved ones or with, other professionals whom we trust and can be vulnerable with, we are practicing the art of just showing up, being ourselves, and letting our compassion and our empathy lead and guide us to, the places where we can say, I'm sorry that you experienced that, or to show up in people's pain and trauma that maybe even people who look like us have inflicted upon them. And so at times we can stand with them in that gap and use the relationship, use our identities in ways that are meaningful and helpful so that they can learn from this experience, and so can we.
Thank you for that. I mean, it's definitely clear there's work to be done on this, like any skill set and any relationship building that you would have under any other context, right? Learning, asking questions, being curious, asking about their experience and trying to stand with them. And again, compassion, empathy, even in areas that make you personally uncomfortable, still exercising that as a professional, right? And their therapist. Dr. Combs, I'm going to pass the same question to you as well on how your approach to allyship and racial equity and how you've borne that out in your work. And then just add a little bit more from another question that came in, which was a follow-up to your terms about dismantling or disruption a bit. And to say, there was a question about how it is that how that actually plays out for you in life. So is that about confronting people at all? And is there room within the system to make change or disrupt, or how do you see, disrupting and dismantling?
Yeah.
That's a lot of questions.
That's a lot, isn't it? Yeah. I just first want to say I was really resonating with everything Dr. Smith said. That I just think that I could answer just by saying what she said, but because it was so much of the things I believe in. But being me, I'll say some more. I think what's important, it's been important to me for a long time, is the continuing work of getting more and more comfortable being uncomfortable, and learning to treasure those moments where you're in a really hard situation, and trying to preserve the dignity of yourself and of the other people present without playing nice. And I think if you can just kind of think that, okay, this is my job here. I don't know how to do it. Nobody taught me 3 steps about this, but I got to think about dignity, and I got to think about what's it like for that other person. I don't know them. I don't know what their life is like, but it's my job to put myself as fully as I can in their shoes, knowing that that's an impossible task to do perfectly. And how do I do that in a way that preserves everybody's dignity? And I've been doing this for a long time now. I'm old. Jill doesn't like it when I say I'm old. I am becoming an elder. And so I do think I have a lot of life experience to draw on now. When I think back to some of the specific life experience that guides me in those kind of moments I'm talking about, I go back to Jill and I had the privilege of meeting with a team of therapists from New Zealand that call themselves the Just Therapy Team. They are an agency in Wellington, New Zealand, that works with Maori people and people from the Pacific Islands, and what they call in New Zealand Pakeha people. That's the New Zealand term for white folk. And they've really taken it seriously in that agency to try to work out what are equitable relationships among the staff in that agency so that they can engage equitably with the people they serve. And one of the things they instituted early on was just sort of an idea that the people who had the most privileged positions in society at large had to listen to the people that occupied the less privileged positions in the society at large and take what they said, that if there was a conversation about an issue in the agency, that it wasn't resolved until the people who were in the less privileged position said it was resolved. So, and just learning to have those long, difficult conversations among colleagues where what was striven for was equitableness. So, and so I think Jill was talking earlier about thinking about when you're in one of those difficult conversations, how is this going to play out for this person of color that I know? And one of the people at that agency is Kiwi Tamasese, who's a Samoan woman who I have huge respect for Kiwi, and she's not somebody you would want to disappoint ever. And in many a situation for 30 years now, when I'm in a difficult conversation, I think, how do I need to comport myself here so that Kiwi wouldn't be ashamed of me, so that Kiwi would, and at the same time, it's not just guilt, it's Kiwi's on my team. Kiwi's got my back here if I just let her in the room with me and I remember everything she's ever told me. If I screw up here, I actually could call or email Kiwi and consult with her, and she'd be happy to tell me how to do it better next time. And I could go through any number of other experiences I've had through the years that I call on, that to the extent that I do it any better these days than I did 30 years ago, would be, I worked for a long time at Near South Health Center here in Chicago, where I was one of the only white people there. And I often think of a woman I'll call Miss Smith, who was somebody that I ended up seeing a whole lot around a whole lot of difficult life problems. And I often these days think about just how would Miss Smith want me to be being in this moment? How can I handle this situation in a way that would make this institution an institution that would serve her needs better? So that's the kind of stuff that I call on. And I don't, and to the instigator or that kind of stuff, that second question, I think it's sort of like, when you're working in a huge corporate hospital environment and there's all this pressure just to diagnose people and bill them properly and move them through the system, so that it just helps me feel a little lighter in step as I'm walking to my car in the parking lot, if I can identify something I've done to push back against the perhaps unintentional inhumanity that just these big systems push on us, where I've done Miss Smith a little prouder by a position I took that day. Yeah, I can go on, but I won't.
No, great. It does, I mean, I feel like you have addressed the question there too. I mean, I think that you are saying that there is room for disruption, dismantling also within the system, right? So it's being aware of the system and making room for others, being present to the things that need to be fix the things that need to be undone and redone in the system, and the new things that need to be created outside, right, that never existed or never let opportunities in for others as well.
I think we nearly all of us work in these big systems or have to answer to these big systems these days. And I don't think any of the people that work in those systems have evil intent or cruel intent, but I think there's something about just the way what I would call neoliberalism, and don't get me started on that, kind of pushes us to be efficient, and to measure how much money our organization is making as the greatest good for the organization, pulls us all away from the kind of standing in each other's shoes that Dr. Smith was talking about. I think it's an act of subversion, an act of resistance anytime we claim that space for ourselves, and it's something we need to help each other feel good about.
Definitely. And I would argue there's not an either or always. I think we've seen them one another. There are certainly things that can be done to help equity, to help level the playing field, that are financially profitable for companies. And there's a lot of research on how increasing diversity, increasing representation is actually very good for the top and bottom line. So it's not that we've pinned one against the other or always done it one way, so we just never look at another way to do it. And I do, I challenge that people believe it's mutually exclusive. I think there's a ton of information out there that says that's not the case at this point. So thank you for that. There have been a couple of questions on this, and I know we wanted to discuss this as well. How do you actually handle it, or what are the tools that you bring when a patient brings things into the room, or your client brings things in like mistrust or racism or rage? Obviously you guys have dealt with people who've dealt with trauma and all of the complicated emotional responses to that. When they bring that actively sort of right there on the surface in your interaction with them, and it can be stemming from things around racial equity and equality, what is it that you do, and what has worked for you in dealing with some of those situations? Can I start with you, Dr. Smith?
Sure. So I think the short answer is to validate it. And back to kind of that self-work, right? If you're a person that within yourself challenges whether or not this person's experience is what they're saying that it is, then that falls on you. So me as a therapist, if I'm questioning whether or not what my client is saying is true, or maybe the emotions that they have are too big or too something, those are judgments, and those are things that we have to kind of look inward to figure out. So validating it and validating it authentically, and really being able to create a space where a person's reactions to their trauma, in this particular case, racial trauma or some other form of social trauma, to give safety in that moment means that your response needs to be one of acceptance that this is not only their experience, but it is one that, whether different than yours or different than anything you've ever heard before, is what is creating such big emotions, as I say about my toddler's emotions, like these big emotions, whether it be yelling, whether it be screaming, whether it be crying, that is what racism feels like. That's what racial injustice and to consistently be re-traumatized for many people in this country, Black and brown people in this country, to almost every day be able to point out a racialized experience, that is devastating, and it is hurtful. So to be able to sit with people in whatever the expression is, means that it's centering their experience and not our discomfort maybe from those, emotions. So maybe I'm having a reaction to someone yelling or being upset or, crying or, whatever it is. But to acknowledge that all emotions in a safe space are welcomed, and that all emotions have a place, means that I have to do my work to make sure that I can respond in a way that is not further marginalizing a person for the emotions that they are expressing. And it still goes back to that self work, right? Like, I, I I feel that if there is an automatic reaction to an emotional response based in something so traumatizing as racism, then it is us that really has to do that work. And an example similar but different, is times where I have somehow been connected with clients who self-identify as white supremacists, and to show up in a room where I am having obviously so many emotions, but to show up for that person in a way that is authentic, that is vulnerable also. So really being able to talk about, how did we end up here? How do we end up here? And here's why I'm asking. And how will my identities impact the work that you're looking for? Having authentic conversations means that we have to be very much aware of what's going on for us so that we can learn how to show up. And show up is not just sitting in the room. Showing up is being right there with our clients, our patients, the people that we're providing care for, so that they can have the safe space that they need, and so that their experiences are centered, whether that be in a way that is, triggering or big, really big emotions.
Yeah, thank you for that. Lots of work on all sides for sure. Jill, can I pass that question to you? So when a patient or client is in the room and they're a high level of mistrust or anger, or they've, as you said before, brought out, racial comments, etc. What tools have you brought to those situations to help?
Well, first of all, I just want to say I thought Dr. Smith's answer was really great. I resonated with a lot of what you said, Dr. Smith. For me, if somebody, I feel honored if a person of color trusts me to express their rage or hurt or experiences of racism. I feel honored. And so I want to sit with them, hear, try to understand, and also let them know that I understand that they could have chosen not to share that with me. And I think it speaks of the relationship that we've been able to develop, and it helps me be in a position where I hope I can stand with them. So I think that's really important. There have been times where I've heard about the situation and I'm the person who names racism. I've had a couple of people just be astounded that a therapist would name what was going on as racism, and being really, really pleased that I've had somebody say, we can talk about that here. We can this to that. And I usually don't want to be the person who names something, but I feel like in this situation, it might be very important for a white person to be willing to name that, and also let go if the person that we're talking to doesn't want to talk to us about it. And I have had people who I can tell through the interaction that they aren't wanting to fully talk with me about that at that time, and it's got to be up to them. So I think what's really important is paying a lot of attention to the person that we're working with. I relate to this idea of doing our personal work. I think that if we don't, as a white person, if I didn't spend a lot of time thinking about what I haven't noticed, what I've taken for granted, what things are different in my experience than could have been, I'm going to miss a lot. And so I have to be, I can't just decide I'm going to walk in the room and do these things. I have to be drawing on a lot of conversations and thought that I've put into it, because it's important as a citizen of the world that I think about this. So I'm drawing on that, but I'm also, it's there in the center of the conversation, and the person I'm talking with, I want to follow how comfortable they are, what steps we can take, how much they want to share with me, and really be sensitive to that. I think it's much more difficult if what I'm hearing is somebody being racist. And I draw on it. When I first got my social work degree, for the first 7 years, I worked in a school for kids who were kicked out of public school. And I remember this 5-year-old, this adorable 5-year-old, spouting horrible racist language. And he had no idea what he was talking about. He had no idea what the implications were. But the gift to me was not being able to separate, like not assuming this is what this person is, but being able to think about, they learned it somewhere. They were in a context where this was the way people were thinking. And that gives enough distance, I think, that it puts me in a position where I can stay connected to them and try to question some things and slowly unpack some things, and hope together we can move to a different place. Because if I don't recognize their humanity and stay connected, I am not going to be in a position where we can do something different.
Thank you. Yeah, that's a great theme across, right? That we keep hearing. It's to how to recognize humanity and maintain dignity, and that is certainly a role of us as providers, regardless of what side of the fence you are, right? If someone's in there spouting racial ideas or racist ideas, or if someone has been at the experience of it and is coming in with rage and trauma and strong emotions because of that, right? Still understanding there was a context for the behavior, the words, and still connecting to their humanity and maintaining their dignity in that. Thank you guys for that. Dr. Combs, did you want to say anything in particular more on this subject? Have you had experiences with this you think you want to speak about?
I guess what I'm thinking about that both Dr. Smith and Jill have touched on, that I would just say a little more about is the work involved in being able to be present in these difficult conversations. And I think as somebody that was raised in a pretty all-white small town in Eastern Kentucky in the late 50s, early 60s, I had a lot of learning to do about things that that people of color had been trying to tell people like me for a long time. It's in writing, in speeches, in lots of ways, and it's been it's taken me a long time. And one of the things I've learned from people of color who have befriended me is that it's not their job to teach me. That there's lots of places out there to learn. There's movies all around. There's lots of good books written. And Frederick Douglass was trying to talk about it all those years ago, and you just name the people on up through the years, you know, and so I think those of us on the white side of the equation do have some, if we're going to take it seriously, to want to do this work, to work toward equity, to be a good ally, there's a lot of homework involved. And it's worth it. It's worth it. And there's just a lot of history. We were very carefully not taught, very carefully, I think, not taught about genocide and lynchings and land theft and everything that happened in Reconstruction and Jim Crow. And if I'm going to empathically be there with somebody that's dealing with the generational effects of that, it's incumbent on me to educate myself about that. And these days it's not hard. I mean, I could go down, Google it. You'll find more than you can read. I currently just discovered this thing that a young Black woman is putting out called Anti-Racism Daily, and it just gives you some a little task every day, and that's my current favorite. That's where I'm getting stuff, but that's one of a million things I can mention. So that's all I would add.
Okay, yeah, great. And I think, just to piggyback of what you were saying as well, I mean, I often challenge my peers and all providers and people in this space that are entrusted in this space in particular, that just like you studied anything else that you knew would have an effect on how well your patient or client did, and that wasn't easy either, but you read it, and you read it over and over, and you and you tested on it. This is similar. It makes you more personally uncomfortable, but when your patient's in the room, I'm an internist, I'll say, and it's a new diagnosis of cancer or something. I've never had it. I've had family members with it, or so maybe I can pull off of something. But I'm not going to shy away from the fact that that's what's going on. That's the root cause that is directly related to your health status. And me sitting with you in that is important, right? Me being truthful and accurate and present with you and developing a plan on how we're going to address what's actually going on is important. So whatever you want to, take cancer out and replace it with something else, or, trauma from racism can be the answer in that blank. And it's still my job to know something enough about it to be able to sit with you in it, to have some sort of presence with you as your provider, right, in some of that. And it's directly related to how well you do in your health status, in your therapy journey, in whatever it is that we're interacting on. So you don't have to be perfect. I don't know everything about cancer either. You can also refer to specialists. You can read more. You can learn more. It's a continual learning process. But I challenge all of us that that's still our responsibility and job, even if it makes us uncomfortable. So thank you guys for all of that. I'm trying to tie in a little bit some of the questions that have been coming in that are related to a number of the topics that we wanted to cover, but I think maybe broadening out this one about how do you best address others who don't grasp the impact of racial discrimination. I think we wanted to talk about a little bit about maybe your peers or coworkers to help them with it, for patients who walk in with that as well and don't even recognize maybe the effect that it's had on their own life and their own health status. You can go with family members or not, but I think some people are also asking about the larger organizations that you touch and are involved with to help with that cultural change. Like, how do you bring that up without there being retaliation, without it being minimized, without how do you help people understand a little bit more? If you can speak to some of that. Can I start with you, Dr. Smith?
Sure. So, we have to acknowledge that, there's so much at play when that question is being asked. So in my experience, people who are working for an agency, they may be therapists or other care providers within an agency where there is, systemic oppression in some way, racism practiced often. discrimination, prejudice, all of those things, we have to acknowledge where our power is, right? So the question comes up because most often it's a person that does not have the power or the most power or changing power within an organization. And so it's, how do I, as the vulnerable person in this relationship or in this agency, go and challenge something, knowing that that also means my job is on the line, or something else might come up. We can't control whether or not retaliation happens. We can't control whether or not, we're fired for asking a question about racism. And so, that is one part of, this process too, is that people who are leaders or have the power within an organization to create such change, they're aware, of that power. And so there are some organizations that are led by people who are at least open to a conversation. There are, times where there are maybe requirements, maybe yearly training requirements. And so maybe we make a suggestion for, diversity and inclusion training, or maybe we make a suggestion about, maybe bringing someone in who can speak to these issues and also speak directly to leadership, within those issues. But yet and still, there's going to be a lot of situations where we don't have the power to speak up. And so that comes in, as a supervisor, when, many of my supervisees are in these instances, or maybe even are the targets of racism or discrimination. We go to what the law says about these experiences, and we also talk about plans for how can we say, okay, obviously this organization is not one whose values match what I need or what I want. And so, maybe there's an exit strategy, and within that exit strategy, we also talk about who we can report this to, on the way out. But at the same time, not everybody has that ability either. And so that then goes to, what's the individual work that we can do? What can we do with our clients, with our patients, with our supervisees, with the team that we might be leading, with our colleagues, with the people who maybe are more open to having these conversations? What might we be able to do to create change in the circles that we can? Again, we can't control everyone. We can't control anyone except ourselves. And so to really be able to look directly at your experience, and what are the fears if you say something, what if you're the first person to talk about racism within an organization, what then does that mean? Do you get labeled as the person who is who's always, saying these things, who's aggressive, who is the angry Black woman who, and that's a label that I'm, often given. Remember, I'm the disruptor. So, that also means that I have to come armed with the fact that organizations can't do these things, and that there are laws set up for that. And so I did quickly see, I didn't read the whole question. Can we work within a system to create change? Absolutely we can, and we absolutely should. But there are some organizations, there are some systems where change might not be as quickly as we need, or look the way that we can. And so then therefore you work with someone, work with a supervisor, with a consultant, who can help you see what the options are. There's nothing wrong with seeing what the options are. Ethics boards are a thing for a reason, because these actions are unethical, and the fear of retaliation is real. Talk about that. Talk about that in therapy, with a supervisor, with someone who is an ally, who can help you to see something, or to see a resolution that maybe fear is stopping us from being able to really see.
Certainly. And change can come incrementally, right? It doesn't have to be sweeping changes like you were saying. Certainly start with yourself, but I found that you can find a couple of different champions, and then that grows into something bigger, and that can lead to some overall meaningful change as well, and build over time and stay consistent. Jill, can I pass this question as well to you around, you know, addressing others who don't sort of grasp the gravity that discrimination can have, particularly within organizations or within your peer group and other clients?
Yeah. First off, I completely resonated with your experience, Dr. Smith, of like being a troublemaker at times, being labeled in certain ways. And I've had experiences where I feel like I've actually made things worse by making a lot of noise about it, and have really thought about that. Like that maybe was important for me to publicly say something, do something, but I'm not sure how effective it was for me. But I'm going to talk about 3 different things that I think that I've been part of that I think have been effective in very small ways. And maybe they'll be, I don't know, it's just what came to mind. The first thing that I was thinking of is, how can I use my privilege to make room for someone else in a context where maybe nobody's thought about it? So for example, I was asked to be on a panel of women talking about something at a family therapy conference. And so I asked who was on the panel, and the panel was all white women. And I said, I think we should have somebody, you know, I don't think this should be all white women. And I made a suggestion of somebody who I thought would be really good, African-American woman who I thought would really be good. And the person said, you know, you're right. I didn't think about her. She would have been good, but we can't have more people on the panel. We can't do it. So I said, well, I'll be happy not to be on the panel. You know, and then she said, well, I'm not so happy about that. And we ended up reaching an agreement that I would facilitate the panel and maybe add something, but not be a main panel person. And then this person was invited. She was fantastic. But I think for other people, I think if they were going to create something again, they wouldn't just not think about the makeup of the people on the panel. So I felt good about that, and I try to do that when I can, like ask who's going to be involved, and can I do something to make room for somebody else. So that's one thing. The second thing, we've been thinking more and more about reparations, and we decided to, we have just a little narrative therapy program. We have a year-long program. We have some other smaller programs, but we just decided it is a program and we could offer reparations. So we put up something on our website that says, we wish to remove the financial barriers that often lead to racialized outcomes and the continued centering of voices from privileged groups, which further silences already marginalized groups. Full and part scholarships are available for members of groups that are historically or presently systemically marginalized or excluded on the basis of race or ethnicity. This includes people with family histories of enslavement, land theft, and/or genocide. Individuals facing other financial challenges due to our unjust economy may also inquire. We're a small institution with no outside funding, which means we may not be able to fully satisfy all requests. If you are from the communities mentioned above, please contact us directly. Your presence is important to us, and we want to work with you to ensure there is a seat for you at the table. And I think that message, besides inviting people who might not otherwise have come, that we've gotten to know and learn from, it also has other people thinking about the position of some people who may want to be in this kind of learning community. So I feel really great about that. And a lot of people have taken us up on it. And some people have said to us, you know, I'm in a okay financial situation. I don't need to have a scholarship, but I feel like I want to be in the program because I feel like I've learned something about your intentions here. So that's been important to us. And the third thing that I wanted to talk about that I feel like has for me worked better than confrontations is just sort of talking about what I'm doing and thinking in an ongoing way. So that has something to do with this that might be different than the other people I'm talking with might be thinking about it. So recently, what that's been for me is talking about the vaccination. And I've had a lot of colleagues who have decided to get vaccinated because it says healthcare workers. But my colleagues are primarily working on Zoom. So I don't think we're the healthcare workers they're talking about. We're not in harm's way. And so a number of people have said to me, have you gotten vaccinated? And I've said, no, here's who I think should be vaccinated. And this is why I'm not doing it. And I'm not wanting to shame people. I understand people's have different experiences. They're making different decisions I might make if I were in their place, but I feel like it's sort of finding day-to-day ways that I'm thinking about that I can include in conversations that might create conversations with other people. I'm committed to doing that, and I'm feeling good about those conversations. So those are some of the ways.
Oh, great. Thank you for those examples and those specific tools. Great as well. Dr. Combs, are there some examples of how you dealt with some of those challenging situations and what you've done?
I think the main thing I'd want to say is this is difficult work. And, the example that comes to mind is I'm on the board of AFTA, the American Family Therapy Academy, which is an organization for teachers of family therapy. And for years, AFTA has sort of, the membership of AFTA has prided itself as being for social justice and trying to be a social justice, feminist, anti-racist organization. And it's been hell trying to get people who are supposed to know a whole lot about systems, people who are supposed to know about how to get people to talk well with each other, and it's been mostly the white people in the organization that have had just so much trouble letting go of our there's all these layers of stuff to work through, and just white supremacy and how to undo it. I'm thinking of Martin Luther King's letter from the Birmingham jail, where he talks about, save me from the white moderate, give me a Ku Klux Klanner any day. It's I can go through lots of different examples of how well-intentioned people have kind of subverted it when people of color have been invited to take a position of power in the organization, but then people of the old white establishment don't even realize they're going behind that person's back, but they do because they're so used to being in power, and it leaves the person that's supposed to be doing that feeling subverted and like they were just put there as a figurehead. And how do you there's a lot of care, and you need to be comfortable breaking a lot of eggs and having some really difficult conversations and going through some hard times if you're really trying to change an organization and make it truly not a white supremacist organization. And
Have
I'm
you
still
ever
there.
done?
Go ahead.
Oh, go ahead.
No,
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 I'm
no.
sorry, I didn't interject there. I do know some of the questions have been wanting to know how it is that you've had those conversations, if at all, you know, how to start them, you know, when they go awry, how that's happened. I think people just want to hear a little bit about that. So when you're recognizing someone, you know, subverting a person of color in a position of power or something, is there a conversation that's had? Is there some way that you try to counteract that energy and action?
Well, you know, the ones I value in retrospect are the ones I hated the most when I was in the middle of them, or felt the most embarrassed by when I was looking back on my own behavior, but where the people on both sides did work through the hurt feelings and the difficulties and hang in there. And I feel like people have been incredibly forgiving of me, but I don't think that comes from nowhere. I think I've worked hard to hang in and not to just run or quit. I just don't want anybody to think that that my experience has been that this is easy work. It's important work. And it's hard work. And I think I'll go back to is it's self-work, but the kind of self-work it is in order to be the self that you want to be, you need to have a team. You need to have somebody that you're accountable to, somebody that'll have your back, someplace you can go to process it when you're about to blow up. And you know it's not going to be good to blow up at the person you're about to blow up at, but you can go vent in a way that you'll get some coaching about how to go back to that conversation and have it again so that it's a useful conversation.
Can I say one thing I've seen you do, Jean, on
Yeah.
that AFTA group?
Mm-hmm.
When there's been stuff that's happened in the whole board meeting where you feel like some of those conversations maybe are just making things worse, you
Mm-hmm.
have like privately said to a particular person, can we talk? You followed it, you haven't let it go. And sometimes if somebody is either feeling shamed or ganged up on or something, it just gets worse. But if you just talk one-to-one because you value the relationship, it seems like I've watched you do that a few times where it's made a difference.
Well, I was talking about dignity earlier, and I think there's something about not quitting, not letting shame make you what the hell? Am I still there? Are you hearing me?
Yes.
I just got this update. Something's happening on my computer that's making me not see you. Something popped
I think
up.
your
I'm
camera,
sorry.
your camera and audio are still
No,
going on our side.
Adobe was telling me that it needs to be updated. It's crazy.
Feel free to ignore that for the moment.
So anyway, where was I? I was in the middle of something very impassioned. I think it's about not giving in to shame, not shutting down, saying, I'm going to go back, I'm going to have this conversation. We're both human beings. We're going to get through it. And it's usually worked out that way. And I've been glad on the other side of it. But I'm also always aware that it's easier for me than it is for the person of color that I might be talking to. It's easier for me as a man than it is for the woman in these conversations. It's easier for me as a doctor than it is for the janitor that works in the same clinic that I'm in. So I'm always
Different
aware
layers.
there's probably things I'm missing out of my positioning. But and the more I can be aware of that, the more useful I can be.
And I mean, I think that comes up for a lot of people, and it circles back to what you guys have been bringing up about your own self-work and self-awareness and how important that is. You know, you have to look at yourself for why is it that you're having this reaction to this person? who's now, maybe been given a position of power, or, if you're having a reaction to it, like, what is that? That's you, right? That really has nothing to do with that person, really, unless you just had a string of really bad personal interactions with them, and it's a really, is a personal thing. It's like, but why are you having that reaction? And why wouldn't you have that reaction if somebody else had gotten the position, even if it wasn't you, right? Say it was you wanted the position or something, but you have to look at why is that there? Why do you feel that way about that person just off the bat? It's a lot more to do with you. The issue with obviously racism and institutional bias and racism is that your issue inside now becomes that person's issue, right? Because you make it so. So you have all the power in the world to not make it so. And that's the work to be done, right? Because you're either because of your professional obligations, your own personal standards, and the goal and the common goal that you've said you're going to work with whatever team or organization or role that you have, it is your job to check that, right? This is where I think policies and things can come into play, and rules, just to help people stay in proper guardrails even while they're doing that work, because you can have good intentions and still really offend people and really do things that are harmful, right? But at least if you have those guardrails around you, like, you cannot retaliate if someone does the following, like you were saying before, Dr. Smith. That helps you check your own behavior, right? While you're on your sort of self-awareness and self-work journey, those kinds of things. So I think those are organizational changes that you can speak to, and even establishing something on your own site that says what you stand for. Those sort of things, like putting that in writing and making that structure to combat other structures that have been existing for a long time. A lot of people have been asking about some resources and things that they can turn to. Like, for example, Dr. Combs, your Anti-Racism Daily, somebody asked about that one. They wanted to know what other ones to look at and what you've been looking at. Jill, they wanted to know where to find the statement that you read, because they wanted to reference some of that language. What are some resources that you use to help you in your continual work in this journey, and maybe even, often pass on to either your clients, your peers, other people you engage in this topic with? Can I start with you, Dr. Smith?
Sure. So and there's another question I kind of want to also answer too, of like, what are the things that we do also to, I believe it was to kind of disrupt oppression as well. And so, as an introvert, as someone who, really is invested in, connecting more on a smaller scale, I tend to have difficult conversations, not just with my professional colleagues, but also in my, with my loved ones. So, I'm constantly in conversation. I'm constantly reading about, what is going on in our world, and not just what's going on for people who look like me or who have the same identities, but more importantly, the lived experiences of others. So, I've more specifically, my goal. So I set a goal for every, couple of months. Sometimes it's based in timing, sometimes it's based in a holiday, where I choose a group of people, or maybe a specific client is presenting with something. And so I make sure that I take on the responsibility to learn what I can, and kind of in the goal of creating culturally responsive treatment, I am, going out and, taking training specific to working with certain populations, or, having conversations with other care providers who outwardly self-identify as a person of within that community, and really kind of, again, kind of this humble space, asking if a conversation, or if some sort of consultation, where if it makes sense, paying them for their time, or something like that, is something that they are willing to do or able to do, making sure that I am engaging there. But also taking it upon myself to, one of my self-care, it's not really self-care, but one of the things that I do is scroll Instagram. And so instead of consistently looking at, all of the challenges over and over and over again, challenging myself to, follow an account that is talking about a group or a community of people or lived experience that I'm not well versed in. And so a lot of people make it, their business. It is their business. It's their, it's maybe the way for them to make money or ways for them to, educate communities, to be on social media in an education, standpoint. So, providing resources and actually going to those resources. So, they might provide a book list. And so I'm going and I'm challenging myself to every couple of months read a different book. So, those are the things that I do myself, but I am also, connected on a political or advocacy level, finding opportunities to meet with, not since COVID, but to meet with various political organizations or advocacy organizations, and really talking from not just my perspective, but maybe the perspective of clients that I've heard. So I did answer 2 of the questions and gave some more resources there, but Instagram, Twitter, Facebook all have so much information that it will take me a lifetime to read. So I absolutely suggest that.
Thank you for all those and for everything you've said today. I know we're coming more to a close. This is the last question for you guys, but Jill, I knew you started with reading that note on your site there. Any other resources that you use regularly and would like to pass on?
I think we sent Motivo some resources. I wonder if those could go out in the letter that people get at the end. I'll just highlight a couple though. Jean wrote a paper called White Privilege, What's a Family Therapist to Do? Published in the Journal of Marriage and Family Therapy. And I think it's a really good paper. And it gives suggestions and talks about sort of the journey he went through thinking about this stuff. I think it's really great. Also the podcast, it's a series called Seeing White, I think is really good. And so when we talk to our group that we meet with every week to talk about examining white privilege, we told them that we were going to be here doing this, and we asked if people were looking for a book that they might recommend for clients, what would that be? And some people suggested a book that I haven't read called My Grandmother's Hands. And apparently it's about racial trauma and especially the embodiment of racial trauma. And several people in our group recommended that book. So I just wanted to pass that along. And I agree with Dr. Smith. There's we could do nothing but read, and the more we can do, the better. But also talking to people.
Problem to have. The better problem to have than in the past, right?
Yes,
Thank you so much for those. Anyone you want to add to the list to highlight, Dr. Combs, to close us out?
Read some James Baldwin.
Yeah.
And
or look at
I actually like Ibram X. Kendi's book, How to Be an Anti-Racist. I think it's a good book.
Great.
There's
Thank
lots
you
of
guys
stuff out
so
there
much.
though.
Yes, and it's it's easy to find if you want to find it, and a wide range of perspectives. And thank you for your range of perspectives today. I'm gonna circle it back to Meryl to close it out. It's a little logistics, but thank you guys so much for your time today, and thank you to the audience as well for staying with us.
Thank you, Dr. Malloy. Thank you, you guys. I took notes. My reading list has grown. I have learned. I will continue to learn. Being a good ally is important to me. And so I hope we all take away and look at actions we can start taking this afternoon on how we can do better to change our society so that it is a good place for people. All people. And when we mean all, we mean all. So thank all of you. I do hope that you will take the time, for those of you who have participated today, to fill out the survey. We started this last year and we did one, and we were also grateful for the information shared and the honest, raw and transparent discussion that took place, that we said we were going to do another one in February, and we have just made it a series. So we're going to do 4 throughout the year. So we want to hear from you all on the topics that we should be covering around racial equity. And please, send us information if you don't get it in the survey, but please do take a moment for the survey. Rachel, you were an amazing chat responder as always, and a good friend and partner. And for everybody who's been on the call today, we wish you a safer and more just society through our own actions. Be safe, be well, and thank you. Take care, everybody.
Thank you.